Ladies and gentlemen, our Innovative Leader of the Year for 2015-2016, John Maraganore. And what we do and what we have for a gift, you know, I can imagine you have a few plaques hanging on the wall and trophies and this, that, and the other. So what we do for the Innovator of the Year Award, we like to give you something that you can make a little more personal. So we have a gift certificate here, so you can go buy a wonderful piece of art from Art and Giving. And what makes Art and Giving so special is, you know, 50% of the revenue generated through the sale of this wonderful artwork goes directly to pediatric cancer research. So we figured we could do nice stuff, you could get a nice piece of art, and also support research, which is something you've dedicated your entire life to. So congratulations, my friend. You are an awesome human being.
Thanks, Bob. I'm really what a wonderful gift and what a wonderful award. It's an award that really recognizes the work of the people from El Nilam, that many of whom are here today. I'm really so thankful to all of you for your commitment and passion over the years. My wife was going to be here today, but she felt ill this morning. But I also want to thank her because she's been such a partner to me in everything that we've done. I consider myself incredibly fortunate to be a longtime member of this environment, this community, this life sciences cluster. When you talk about innovation and leadership in the life sciences industry, Massachusetts has got all the key ingredients that make it the special sauce. There's no place like here. There's no doubt about that. We all know that. It's a place where world-leading academic research scientists and medical researchers can combine and interact with entrepreneurs, a deep, deep pool of entrepreneurs and associated talent that we have in the Commonwealth, and get access and interact with venture capitalists and funders that can help us capitalize and build and fund such amazing biopharma companies. It's no surprise that virtually all of the major pharmaceutical companies have some presence in Massachusetts, no surprise whatsoever, along with the over 500 biotech companies that flourish in this community. I first entered the life sciences community of Boston in 1987. In fact, tomorrow will be my 28th year. I started on April Fool's Day for some bizarre reason, but I'm looking forward to celebrating my 28th year here. And for this entire time that I've been here, I've actually been somewhere in either Kendall Square or Central Square. And, you know, it's always been commuting from home and just turning into one parking lot versus the other, but it's always been within those two different wonderful communities. And as I reflect on my time here, I continue to be impressed by the key features of this community that make it so successful. It's just remarkable. There's a remarkable spirit of collaboration and camaraderie between the biotech leadership here in Massachusetts, and I think a lot of that goes back to the namesake of this award, Henri Termeer. In fact, even when companies are competing strongly with each other on a given product, we find that the leaders of those companies will often get together and unite when it comes down to supporting this overall community. It's just a remarkable feature, and we don't see that in other biotech clusters across the country. It doesn't exist in the Bay Area, which of course is a competing cluster at all. Those CEOs don't get together that often. The CEOs in this community get together frequently to talk about what's going on and to try to find solutions. There's also a remarkable energy in this cluster where any given day you'll bump into a Nobel laureate or a former industry colleague or a venture capitalist, whether it's at the Starbucks or the Legal Seafoods in Kendall Square or just on the street. And there's a buzz about this community that's just unmatched anywhere in the world. Now at El Nilam, and you heard a little bit about this from Bob, we have a deep commitment to this cluster. We've been headquartered here since 2002, with 4 of our 5 founders being from and in Massachusetts, and 2 of our 4 original VCs having been in Massachusetts as well. We now have 400 employees at the company. We intend to grow and stay here and build our company as a Cambridge-based organization and aim to have nearly 2,000 employees by the end of 2020, which is our growth trajectory that we are on as we speak. And we've consistently expanded our footprint here in Massachusetts. As Bob said, a very recent development is the commitment we made out in Norton and the decision we made to build our manufacturing facility here within the Commonwealth. We could have gone elsewhere. We looked elsewhere. We examined the other alternatives because we had to do that as a business to think about where the best potential places would be for not only our company, but also for our shareholders. But we realized that the talent pool that we can get access to with a very specialized manufacturing facility was going to be unique and important to be here in Massachusetts. So we're very pleased to have made the commitment and have bought the 12-acre plot that we have out in Norton and to begin building relatively soon. We're going to take advantage of the very nice winter we've all enjoyed this year and be able to break the ground a lot faster. And in fact, we'll have a groundbreaking ceremony with the governor. And Bob, I hope you're able to make it on late April, April 28th, I believe is the date. So if you're able to make it, that'd be terrific. As I said in the beginning, this award really recognizes the amazing efforts of Alnylam employees, many who are here. There's some former employees as well that are here. And I've had the pleasure of working with this group for the last 13 years. We're coming on to our 14th year as a company and my tenure as well. And we've been focused, as you perhaps know, on building and advancing what could be a whole new class of innovative medicines, specifically RNAi therapeutics. When we got started, RNAi was raw science and a lot of hope and a lot of promise. It was not much more than that. And the basic discovery, in fact, that led to the Nobel Prize in 2006, when we got started, was only 4 years old. The paper was published in 1998. We got started in 2002. And the work of our founders, notably Tom Tuschl, that was the first to describe RNA interference in mammalian systems, was only 1 year old. So it really was very, very raw science. And as you can imagine, it takes incredible perseverance and passion and scientific excellence to go from this very early start to have ultimately a company that has now 9 programs in clinical stages, including 2 in phase 3, that is now positioned to file its first NDA, if all goes well, of course, in 2017, and to launch our first product in 2018. It also takes a strong IP estate and a huge amount of capital to do this. And on the side of capital, just to give you some numbers, since inception, we've raised over $2.5 billion as a company and have invested about $1.5 billion to date. And if you look at the investment level that we have going forward, it's still very significant before we're profitable. We had enormous hurdles to overcome as a company, and we're certainly going to have more hurdles in the future as we grow. There was a time just 4 to 5 years ago where most people thought RNAi therapeutics and Alnylam were dead, but that we just hadn't lied down yet. It's not easy to do what we do, and it wouldn't be innovation if it were. At Alnylam, we talk about our innovation using the Greek word kenotomia, which was the Greek word that was first used to describe innovation by Aristophanes in 422 BC in his play The Wasps. And as you can imagine, as a satirist, Aristophanes commented on the innovators as being unusual people doing unusual things, and they were somewhat ostracized or viewed by society to be outcasts. Well, that's what innovation's all about, isn't it? It's about doing something different, doing something unusual. People may not believe you when you first get started, but ultimately, if you succeed, that innovation can become a reality and can become important. What really drives us at Alnylam is our commitment to make a difference in the lives of the patients we serve. It's to help Isabel, a young mother in Mallorca, Spain, who is taking patisiran as part of a clinical study. She's afflicted with the drug TTR amyloidosis, a debilitating disease with no medicines that are available today that can halt neuropathy progression. It's to help Holbrook, a remarkably talented young scientist who with severe hemophilia A and inhibitors, who died last month of an intracranial hemorrhage while he was waiting and hoping for future therapies like fitusiran, our drug that we're advancing for the treatment of hemophilia. And it's to help many other patients that we can address with rare diseases like paroxysmal nocturnal hemoglobinuria, porphyria, alpha-1 antitrypsin deficiency, amongst other diseases where innovative new medicines are going to be needed. The panoply of drugs and approaches that we have, the modalities that we have today are not going to be sufficient to treat many of these diseases. We need new modalities, and we're committed to one of those new modalities. We now enter a stage of our company's growth that we call Alnylam 2020. It marks our transition from a development stage company to a multi-product commercial stage company with a deep and sustainable pipeline behind it. And that's a profile for a company that has been rarely achieved in the biotech history. It's oftentimes the case where a company gets to market with one product but no pipeline, and of course very, very often the case where a company never gets to the market and goes away. So that's the nature of where we're going, and it's an exciting time for the company as a result. Now, in a few last words, I'd like to turn to some broader thoughts on our industry. And for starters, let me say that I have never been more excited about where this industry is going and the impact that we can have for patients. It starts with the science, without a doubt, and I think it's very clear to all of us that the pace of biomedical discovery has never been faster, and our understanding of human disease has never been deeper. To put this in a personal context, just 7 years ago, my mother died of CLL. And if she were alive today, just 7 years ago, she would not have died. There are therapies available today, both on the market and both in development, that would have made a difference, a fundamental difference in her life. And that's just 7 years. And as I look forward, more broadly, I would look forward to hematologic malignancies. I think within a decade, almost all hematologic malignancies will be diseases that people can be treated with, but they won't die from them. They may die from other causes, but not from hematologic malignancies. And I look forward to other impact that we can have as an industry on diseases like Alzheimer's and schizophrenia, amongst many others. I'm also excited about the current regulatory environment. We've never had a stronger FDA who shares a commitment to advance medicines to patients as fast as possible, as long as they're effective and safe. But that commitment to speed and urgency is something that we haven't seen at the FDA ever, and it's great to see it. We also have new pathways like breakthrough designation to help make those therapies available. And I think all of us, when we look at the productivity curves that we've looked at in the past around R&D investment and NME approvals by the FDA, we're now seeing a change. We're seeing a change, we're seeing an increase in approvals, 45 approvals last year that occurred. This is a change because the science is now informing us how to develop medicines better than ever before. And it's so evident in the pipeline. If you look at a consolidated pipeline of the industry and look at the type of medicines that are emerging from a consolidated view of the industry, it's amazing to see the type of new products that can emerge. Now, we do have some headwinds in this industry, and it starts with the national debate on drug prices. We need to focus this debate on the value of our medicines and the access of our medicines to all patients. On the value of medicines that save lives and substantially ameliorate disease, and on the access of these medicines for patients who need them. We need to remind the public also that the medicines we pay for today are free for our children and free for our children's children, and that we have a social contract in Hatch-Waxman that enables the innovator for their hard work to have some defined period of reward, but thereafter, that reward goes away with generic drugs that come to market. We need to make sure that generic drugs can come to market quickly and help the FDA do that as well, so that ultimately we have an innovation cycle that continues to drive new and exciting innovation going forward. But again, the medicines we pay for today are free for our children. When was the last time we worried about the cost of ulcer drugs or hypertension medicines? We don't worry about that anymore because those drugs are generic and they're free. We also have to focus this debate on the totality of healthcare costs, not just drug costs alone. And we need to work with other stakeholders on this issue. Drug costs still remain only 10% of total healthcare costs, and it's remained stably that way for decades. So we have to work with these other stakeholders to see ways that we can decrease overall costs of healthcare. We also need to cry foul on health insurers who have managed to raise drug copays and are doing what insurance companies always do. They make you pay your monthly premium, they tell you they don't cover your problem when you have it, and they take the profits from that and they build the tallest buildings in every American city, including this one. But we, industry, also need to do something different. We need to develop performance-based and annuity-based funding approaches for our medicines. We also need to fuel our growth and innovation with innovation and value, not through arbitrary price increases. So we, too, as an industry, need to do things different. And while the political demagoguery of the current presidential election year is damaging to the efforts of many earnest companies trying to take medicines forward to patients, I do welcome the debate on drug prices because I think it provides us the opportunity, perhaps for the first time, to really get together as an industry and to find solutions. And while Alnylam is still a pre-commercial company, we are thinking a lot about this topic. You're going to see Alnylam be as innovative as a commercial company as we have been as an R&D company. including approaches to thinking about pricing that are based on value and performance of our medicines, not simply by unit prices, and to also think about how we can build our company through growth and innovation, not through price increases. So in closing, I'm very humbled, Bob, with this award, to get this recognition from my colleagues in this industry and in this Commonwealth is just amazing to me. Of course, it is Al Nilam's award, as I see it. It's the hard work of our employees that have allowed us to do what we've been able to do. So I sit here and stand here in recognition of their great contributions. So thank you very much.